In this video, we're looking at taping for edema and bruising for the knee joint. Patients that present with a knee that's very swollen is either synovial effusion or can actually be known as a hemarthrosis. One needs to decide on exactly what's causing the pain. But in the terms of trying to reduce the swelling, we can actually use kinesiology tape and it works very well. I prepared 2 eye strips that's actually cut into 5 individual fingers, and we have 2 of these. So we are going to put a little bit of stretch onto the knee in this position, but remember we can only go as far as comfortable for the patient. So first of all, we're going to split each individual finger. Then apply the pad which goes towards the lymphatic nodes, this time in the groin, so the inguinal lymph nodes. So this one's going to go starting on the lateral side. Not that it matters, we can do the first one on the medial side if we wanted to. So above where the swelling would be. And then the fingers, so if you lock it and then pull it, then that will split the finger, coming down to the first square. And again, it's very tempted to stretch this, but think about where the swelling is all over the knee. This is going to cross the knee, like so, and just lay it down with hardly any stretch. Pull back the second one. You'll probably notice that it's a little fiddly, but it's quite satisfying to do this, knowing that it can really help the patient in terms of reducing their swelling. We can use the standard way, ice and compression to have a bandage. We can apply ice directly over this tape because it's waterproof. But I'd probably suggest icing only rather than applying a compression bandage. So we have the effect of this tape rather than the other tape. And you'd be amazed how quick this would actually work to reduce the swelling. So that's the first application. The second one is going to go, so that's lateral, come into the medial side. Now we're going to go from the medial and then finish on the lateral side. So again, break individual fingers. And then from here, apply that on the medial side. And then simply speaking, the fingers of the second application are going to cross with no stretch the first application. Like so. I've also rounded off each of the fingers on the ends, because when you put your trousers on and off, etc., then it might cause a lifting effect. So if you've got the time just to prep the ends, it might stay on for a bit longer. And we're on the last one. Like so. Using the back of the tape, heat activate the glue just for a few seconds. And there we have kinesiology tape in for an edema of the knee joint.